Hello, New Lenox. I'm Nancy Hoehn, Economic Development Director for the Village of New Lenox. And today, our Notice New Lenox program brings us to the corner of Cedar and Francis, where we're visiting the animal clinic at New Lenox. We're going to go inside and see what Dr. Ubatuba has to tell us about their practice here. We are located in the same parking lot as Little Joe's Pizza and CP Meats. Let's go on inside. Hello, we're now inside the animal clinic at New Lenox, and I have Dr. Mary here with me, and we're going to visit a little bit about the practice. So thank you so much for having us in today.
Thank you for coming to visit us.
Yeah, well, as we've talked, it's kind of nice to bring some of your prospective patients into the practice here and give them a chance to get to know you and a little bit of background about the practice. And so I understand you are a U of I grad. That's where you did your work. And you've been here in New Lenox or with the animal clinic for 3 years now, that's correct?
That is correct. I'm a Lockport resident for the past 5 years, and then the past 3 years I've been practicing here at the animal clinic at New Lenox.
Good. Well, and I think just so people get a little bit better overview, can you share with us a little bit about your staff here?
Yes, definitely. I'm one of 2 full-time doctors here at the clinic. And then Dr. David Takel is our second full-time doctor.
Okay.
He's been at this practice for the past 9 years, so he's very familiar with the community. And then we're a small staff. We have 4 technicians and 3 receptionists, and they're all from the area. And some of them have been here a good 10 to 12 years.
Good. Well, that gives you some continuity with people because
Definitely.
As at least my family, the pets are definitely family members. So it's important to get as comfortable, at least I feel, with who's taking care of my pets as it is who's taking care of the rest of my family. So
that's definitely something that's very important to us as well. We pride ourselves on trying to really treat each of the patients we see as a family member, and as a small clinic, that is something that we are actually in a position to do here. Mm-hmm. So everybody knows our patients by name.
Right, and you obviously deal in companion pets, so it's primarily cats and dogs?
Correct. We are a cat and dog practice. We do see some exotic pets here occasionally for things like wing trims or toenail trims, but Dr. Takel and I, we both really enjoy taking care of dogs and cats, and would prefer to do a really great job with them. Mm-hmm. So we try to help out our exotic pets if they need it, and we can send them to a place where they can get full care too.
Right, because I mean that's a whole different aspect of practicing veterinary medicine, isn't it?
Definitely,
yeah.
Definitely. There is plenty of differences even between the dogs and the cats, honestly.
Right. Well, and you were explaining to me that I think it's kind of interesting, your practice falls a little bit between being kind of the big corporate and the local independent. So I think it's kind of the best of both worlds. You are part of a larger company, but you have a lot of autonomy right here in New Lenox.
That's exactly it. We're part of the VetCorps family of hospitals, and it's a smaller group. They have about 60 practices in this area and then on the East Coast as well. And we have 2 other sister hospitals in the area. And it's a really great situation to be in because we have the support of the larger group. Mm-hmm. They'll help us get the newest equipment. We have a digital dental x-ray that is coming in, but we still can definitely keep it a homey practice and treat the patients here like the community wants them to be treated versus against a standard.
Right, and you said that you kind of you are able to use your own protocols when it comes to what you're dealing with your patients, and that's something that you have that discretion at on a local level.
Yes, most definitely. And we can talk with every individual about their pet's care and really tailor it to them to what they want. And it's a great situation to be in, honestly.
Well, and I think that's a really good point, because I think some people, you know, as practices have grown, or as more the corporate side of things has come more into veterinary medicine, I think a lot of people fear that you lose that connection with the staff and with the physicians that are local, and that, you know, it becomes a little more impersonal.
Yeah, that's definitely can be a concern, especially if you're talking, you know, a bigger practice where you have a lot of people coming in and out. But I think we do a pretty good job here of knowing the individuals, and that's a way that I want to continue to practice.
Sure. Well, and I think the thing that people sometimes struggle with their pets is no one, you know, they can't tell us what's wrong with them.
Yes.
So you tend to sense something's going on, and obviously, you know, you keep up with the well care and the preventative things, which obviously you guys do a lot of.
Yes.
But you know, you guys are a good resource to people when they aren't sure what's going on with their pets.
That's exactly it, and I tell a client probably at least every couple weeks, I wish that, you know, Fluffy here could talk to me and tell me what's going on, because you do have to kind of hunt through the clues to see. And as a veterinarian, we are a resource because we see sick pets and we make the decision, you know, who do we feel is just a little under the weather and, you know, just needs a bit of supportive care versus who really needs more aggressive treatment. Because dogs and cats, they really can't talk to you and tell you exactly what's going on. So we're always here available for a phone call with someone. If we have a client who calls during the day, I'm happy to talk with anyone. Dr. Takel is as well. Technicians can answer questions. So we want to be a resource for everyone.
And if someone's concerned, you can get them in right away and make sure that it's not some bigger issue that you need to be taking care of immediately.
Yes, we do. And even if we're booked, if someone calls and says, you know, I'm really worried, again, that's one of the nice things about being a smaller practice. We can say, we'll get you in, we'll fit you in, we'll get him looked at, and then I think everyone, as long as everybody knows that their own pets will get that same consideration, people generally are pretty understanding if we need to shift things a little bit. So we try to do that.
Yeah, no, that's a really good point. And the one thing that you were telling me too is that you have a lot of diagnostic ability. You were getting some new equipment in, and one of your personal areas of interest is on the dentistry side of things, which just amazes me, because I mean, when I was growing up, I don't know that anybody cared about their dog or their cat's teeth, but now it's, you know, toothpaste for dogs and, you know, cleanings, and it makes a big difference to their overall health, doesn't it?
It does. In human medicine, they have done research that shows that dental health can be can have a big impact on overall health. And our dogs and our cats, they're living longer, they're having a full life, and it's something that we've seen that we can address with them. Dogs and cats, they try to hide pain. Even if they've got a sore tooth that's infected, they'll still be eating, because they're just driven that way, and that's how they're designed. So we try to really do everything we can to just make their life as quality as we can, and then keep them with us as long as we can as well.
So along those lines, you had explained you can do extractions here in the office and those types of things.
Yes, yes. And when we have a dog or a cat get their teeth cleaned here, they actually have a very similar exam to what you would have at your dentist's office. We probe the gum line, we check for any pockets up into the root of the tooth, we scale the tooth above and below the gum both.
And they're asleep for this.
They are asleep. Yes, they are asleep.
Hold still, please.
Yes, they are asleep. And you know, it's a bigger deal for a dog and cat, or a cat, to get their teeth cleaned than us, because they are asleep. But as far as the anesthesia and things go, we have a technician dedicated to monitoring while they're under anesthesia. Every drug is calculated for the individual patient, and we watch their blood pressure and their heart rate and respiratory rate. And so despite it sounding like a very worrisome thing to have occur, we really do a good job taking care of them, and almost all of our pets do very, very well.
Good.
And it's a huge benefit for them.
Good, good.
So.
Well, I think the other thing that I want to make sure everybody knows too is that, you know, you have this passion for dogs and cats, and you practice in the veterinary field, but kind of extends beyond that. You guys work extensively with some of the rescue groups in the area, and I think that's important too, because obviously you come into contact with maybe families that aren't able to keep their pets because of financial situations or moving or kids' allergies. And I would assume that some of those contacts that you've made with the rescue groups helps not only in placing animals, but maybe you can help some of them find homes too with some of your customers.
Definitely. And working with the rescue groups is a very big part of a way to give back, and we can donate time, we can donate vaccines.
Well, that's very true, right?
You know, and there are so many dogs and cats in this world who do need a place to be. And we work with Illinois Animal Rescue, who is a larger rescue. They're based out of Wakanda, but they do a lot of rescues in this area. We've had a long-standing association with TLC Animal Shelter in Homer Glen.
Now, do they do primarily cats?
Dogs and cats.
Both? Okay.
They do both there, dogs and cats. And then we also started working just recently with As Good as Gold Golden Retriever Rescue as well in the area.
Right.
And we're looking to expand.
Good.
So.
Well, and I think there's such a huge need, and I think a lot of it is, you know, educating everybody that they should get their pets spayed and neutered.
Yes.
And obviously any dog that's placed through rescue, they do require that. So obviously, as you mentioned, there's a lot of veterinary services that are necessary just to get these dogs into permanent homes and the cats. So no, it's nice to know that you've taken that stake in the community to try to help with that too. So
my own younger dog, she was an Illinois Animal Rescue dog. Yes.
And is she a mix, or
she is a mix? She is a Labrador mix, probably with a little pit bull in there. And she came from Illinois Animal Rescue, and she came in as a transport puppy, and I saw her, and
that was it, huh?
Yep, I just fell in love with her.
Well,
so
that's wonderful. That's wonderful. Well, and I know one of the other questions that I wanted to ask you too is that a lot of people, you know, are concerned that maybe they have an emergency come up when you guys aren't here. I mean, I'm assuming that you make sure that everybody knows where they would call, who you would refer them to in a case of emergency, and there are local resources for that?
There are. The most commonly used emergency clinic is Animal Emergency of Mokina.
Okay.
And they do a very good job. They're nearby, and they're there when we are closed for the day. They open in the evening, and on the holidays they're there, and it's an excellent resource because not only do they have their doctors there, but they have technicians on staff, so they can do any diagnostics that need to be done on a pet who gets sick in the night. There's a few other ones as well. Arboretum View Animal Hospital is up 355. But Mokina is generally where we have people go, and their number will be on our answering machine if you call, if no one is here. We also try to make sure we send it home with all our new puppies and kittens to make sure people do have somewhere to go.
Well, and I'm standing here in front of the food display.
Yes.
So obviously one of the things too that you guys deal with is pet nutrition and trying to make sure that people understand what they should or shouldn't be feeding their cats and their dogs, and they can get the food right here while they're in for a visit, right?
They can, and a lot of the foods that we have here are more for specific medical conditions. So we do have food for cats who are in kidney failure. We have food for dogs who are predisposed to getting bladder stones. So we have a lot of those resources, and you know, veterinary medicine is great because there are many ways to deal with a pet's issues.
Or prevent some
from happening in the first place. Yes.
Well, and I think a lot of people just tend to go grab something off the bag when they're at or off the rack when they're at the grocery store, and maybe that's not necessarily the best thing. So I think the other thing we'd advise the public to do is to talk to their vet about you know, what they should be feeding and what they shouldn't, and I'm sure there are different options out there that are suitable. But
definitely, and there's treats you can give. I talk every day with people about weight management with their pets, just discussing, you know, dog food, measuring how much you're giving them so you have an idea. We think of dogs and cats as being very smart and regulating their own weight and their own food intake, but they don't necessarily do that. They will overeat if we let them.
Especially when someone's feeding them from the table and stuff, right?
Yeah, so, and you know, some of that, everyone's going to feed their dog a little bit from the table, but we can talk about strategies to try and help your pets feel more full and feel comfortable, ways to monitor what they're eating, ways to keep them getting treats and getting rewards, but not adding too many calories. Counseling about weight management, like I said, I do it every day.
Good. Well, and I think people need to view you guys as a resource other than just maybe health issues, but behavioral issues as well. I mean, you have pets that have storm anxiety,
Yes.
or they don't do well with housebreaking and some of those things, and maybe those aren't things people would typically feel like they should take your time to talk to you about.
And everyone should feel fine taking their time to talk with us about it. Behavioral issues, it's part of healthcare for dogs and cats, and behavioral issues are the #1 reason why dogs and cats are moved from one home to another.
Right.
So we definitely have training on these issues, and we want to take the time with people so that they have a happy relationship for both the pet and for the human.
Right. Well,
So-
a lot of times it's training us to know how to handle them, right?
Yes, it can be.
Right.
It can
'Cause
be.
you don't necessarily know that either. So.
Yeah.
So, well, that's really great. Before we wrap up here, what else would you like the public to know about your practice?
Well, I would like the public to know that we are committed to really getting your pets the best health care that they can. And, with the economy being the way that it's been a struggle for many people.
Right.
And that's definitely something that if you feel that you want to get that health care, we'll figure out a way to do it, whether it's staggering things, prioritizing what needs to come first, but just coming in to see your veterinarian on, say an annual basis to talk about those issues, that's the most important thing. And when we do our physicals, since dogs and cats aren't able to talk to us and tell us they've got an issue, coming to the vet is a huge resource that way, because that's our job, is to
Right.
know what's normal and to tell you if we notice something that looks a little that we want to investigate further.
Sure. And I think that's a really good point, because I do think a lot of people maybe feel guilty that they can't go do everything right now
Yeah.
for their pets, but you obviously understand that and can
Yeah.
help them figure out, well, if it's strictly an indoor cat, maybe they need these vaccinations, but you could do without this right now, or,
Yeah.
manage through some of those things a little bit. So I'm very glad that you brought that up. So.
And I would much rather have someone who really is invested in their pet's care to come in and say, I want you to just take a look and kind of see where we can go from here, versus being put off from the idea of coming in at all.
Right.
Because that's something that, again, we talk with people about every day, and it's not something, we want them to get the best care that we can, and we'll work with our clients as much as we can to get to that end.
Good. Well, thank you. You obviously really enjoy what you do, so.
I do. I
Yeah.
do like it quite a bit.
Good.
So.
Good. Well, thank you so much again for having us come in, and this way, as people drive by and they see your building here, they'll know who's inside, and
Yeah.
if they don't have a vet or they want to, investigate more, I'm sure they can just call the office. Do you have a website as well that people can go
We
to?
do.
And
Yes, we do have a website, and then we're also on Facebook as well.
Good. So they can check you out there and find you guys easily.
Yep.
And well, we wish you all the luck. Thanks again, and it was a pleasure to meet you.
Well, thank you very much.
Yeah,
It was a
thank
pleasure
Dr.
to meet
Mary.
you too.
Yeah, thanks. Well, New Lenox, please come in, meet Dr. Mary, and get to see her practice. And we hope you all have a great day.